Right. So today we're diving deep into healthcare,
Okay.
specifically in Spain.
Interesting.
Yeah, we're going to be looking at this opinion piece by psychologist Pilar Enjamio for OK News.
Right.
And she doesn't hold back.
Oh, really?
She shares some pretty intense personal experiences with healthcare.
Wow.
And then throws out some pretty bold ideas about how to fix things.
I'm intrigued.
Yeah. And I think it's really fascinating to get this perspective from a psychologist, right?
Absolutely.
Because she's not just coming at it from, wait times or insurance costs or,
Right.
the stuff we hear about all the time.
Yeah, the typical complaint.
It's more about that human element, like that doctor-patient relationship, that connection.
Yeah, that can really make or break the whole experience.
Absolutely.
Yeah.
So one of the things that really jumped out at me was this idea that healthcare, especially in private practices, is becoming way too impersonal.
Interesting.
Like she talks about feeling rushed through appointments.
Yeah.
Feeling like her medical history wasn't even considered.
Oh, wow.
And even being dismissed when she brought up some pretty serious side effects of medication.
That's pretty bad.
I'd be furious.
Yeah.
Yeah.
I can imagine feeling really frustrated and unheard.
Totally.
In that situation. And it makes you wonder, right?
Yeah.
What are the consequences of that kind of approach?
Exactly.
When patients feel like their concerns are just being brushed aside, it can have a ripple effect.
Yeah.
Misdiagnoses, maybe treatment plans that aren't really tailored to their needs.
Yeah.
And then just this overall distrust in the healthcare system.
Right. And not to mention the emotional toll.
Oh, absolutely.
Right. Like just feeling like you're not being taken seriously.
Yeah. Feeling dismissed by someone who's supposed to be caring for you.
It's awful.
That's gotta be tough.
But then she drops this bombshell.
Okay.
This anecdote about a doctor who straight up refused to treat a patient.
What?
Because he said he didn't feel empathy for them.
Are you serious?
And that's when I was like, what? Oh, hold on.
Yeah, that's a little alarming.
Yeah. Is this like a bigger problem?
Right.
Like what happened to the whole,
Yeah, the Hippocratic Oath and all that.
The oath. Exactly.
Right. It's definitely a worrying story.
Yeah.
And it raises some serious questions about empathy's role in healthcare. I wouldn't say it's like a widespread epidemic or anything.
Okay.
But there's definitely growing concern about what some people are calling an empathy gap in medicine.
An empathy gap.
Yeah, and there's actually research on this.
Really?
Yeah, showing that things like burnout and these ever-increasing workloads and just the general pressures of these modern healthcare systems,
Right.
it can wear down a doctor's ability to connect with their patients on a human level.
Wow. So it's like the system itself is working against that human connection.
Yeah. It's kind of a sad irony, isn't it?
Totally.
Yeah.
But here's where it gets really interesting.
Okay.
So Enjamio then goes on to praise state-run healthcare.
Huh.
She talks about the thoroughness of the care
Okay.
and the dedication of the professionals she encountered there.
Interesting.
And it makes you wonder, are there some fundamental differences between these two systems that are leading to such drastically different experiences?
Yeah, it's a good question. It's a complex issue, of course.
Yeah.
No healthcare system is perfect.
Right.
And there are good and bad examples in both the private and state-run models.
Yeah.
But there are some inherent differences in how these systems are funded and organized.
Right.
And those differences can definitely impact the patient experience.
Okay, so what kind of things?
Well, you've got things like patient volume, the amount of administrative burden on physicians,
Right.
even cultural attitudes towards healthcare can play a role.
Interesting.
Yeah.
So Enjamio doesn't just point fingers.
Right. She actually offers up a pretty bold solution.
Okay.
She thinks there should be mandatory mental health screenings.
Wow.
For all professionals, but especially those in healthcare.
Interesting.
I gotta be honest. I'm a little torn on this one.
Yeah. I can see how that would be controversial.
Yeah, part of me thinks it's a great idea,
Mm-hmm.
but then I also think about the logistics
Yeah.
and the ethics of it all.
Right.
It's tricky.
Yeah, it's definitely a thorny issue.
Yeah.
On the one hand, you could argue that regular mental health checkups could be really beneficial, for identifying professionals who are struggling with burnout or compassion fatigue,
Right.
and then getting them the support they need.
Yeah.
But then on the flip side, you've got these issues of privacy,
Right.
confidentiality,
Mm-hmm.
potential stigma,
Yeah.
and then, of course, the whole question of resources and infrastructure.
Yeah.
How do you actually implement a program like that effectively?
Right.
It's a lot to consider.
Yeah.
Yeah. It's definitely thought-provoking.
Yeah, for sure.
And I think it speaks to this bigger point
Yeah.
that Enjamio keeps coming back to, which is this need to reclaim what she calls that hand, that friend approach to medicine.
Okay.
And she actually got that phrase from her father,
Oh, wow.
who was also a doctor.
Oh, how cool.
Yeah. And it really makes me wonder, in today's world, with all the complexities of the healthcare system,
Yeah.
can we actually get back to that level of human connection?
That's a great question.
And what's our role as patients
in
making that happen?
Yeah. Are we part of the problem? Are we part of the solution?
It's something to think about.
Yeah. I love that she brings that up.
Me too.
Really gets you thinking.
And, in Jamio's article, it really does make you stop and think about what healthcare should be about. It's not just about tests and treatments.
Right.
It's about that human connection, empathy, recognizing the individual needs of each patient.
Yeah. She really drives that point home.
She does. And for anyone who wants to dive deeper into this, you can find Enjamio's full article on the OK News website.
Okay, great.
It's definitely worth a read.
I'll have to check it out.
Thanks for joining us on this deep dive.
Of course.
As always, we love to hear your thoughts on these important topics.
Absolutely.
So let us know what you think.
Yeah.
We'll see you next time.
All right.